Hello and welcome to this recorded presentation for the employee benefits for employees at WithIN Design, the plan year beginning July 1st, 2022, running all the way through June 30th, 2023. My name is Bill Hammett. I am proud to be your insurance broker. My contact information is on the screen there. I'll be happy to help you with anything I can. Also available to you throughout the year is Rhiannon Gibbs Lopez. She is the senior account manager assigned to this case, and she is available throughout the year for claims issues, finding doctors, help with anything with the plan. Both of us are here for you throughout the year. Quick agenda, we'll talk about a timeline, we'll talk about medical plans, dental and vision. We're going to do a quick run through of the EASE enrollment portal. And if you have any questions or need any answers, you know how to get a hold of me. It's right there on the screen. So let's talk about our open enrollment. We are going to be doing open enrollment from June 6th through June 15th. This is our time where we are able to enroll or disenroll in benefits. We can add or remove dependents. We can change plans, go from the HMO to the PPO. We can add benefits, or we can add dental, whatever it may be. Any changes that you make would be effective July 1st, 2022. We're asking that everybody complete their enrollments no later than Wednesday, June 15th. We'll be completing all these enrollments online at the EASE Benefit Enrollment Portal. We have 11 plans available from California Choice. We have 4 PPO from Anthem, a number of Kaiser plans, Sharp plans, United Healthcare. With all 4 of these insurance companies, you're going to be able to access pretty much any doctor that you would want. You've got the largest grouping of providers with all of these companies, so very, very robust offering. Since there are 11, I can't really show you side by side everything, but I did want to give you a look at what in the enrollment portal you'll see is all plans side by side comparison. I'll show you where that is in a moment. But this is embedded into the enrollment portal. So if you wanted to see how these plans look alongside one another, you would be able to do so very easily. So that's what that will look like. So let's talk about dental and vision. Our dental plans are through Delta Dental. Our vision is through VSP. We have 3 HMO dental plans from Delta Dental, our bronze, silver, and gold plans. The bronze HMO plan is really a great plan for any of you that just want a couple of free cleanings. You don't have much else in the way of needs. This is a very, very inexpensive way to get yourself some free cleanings. The co-pays are a little bit higher when you need to use the services for basic and major services. Silver and gold have lower co-pays when it comes to these benefits. All 3 of these plans are the same exact network of dental providers. So it's the Delta Care USA HMO network of providers. And if you choose an HMO dental plan, you are choosing something that is going to be a very low cost way to access dental benefits. But keep in mind, dental HMO plans don't have nearly the number of providers available to you to utilize as does a PPO plan, but it costs more. Or cost less than a PPO plan. Also to know with dental HMO plans, you must choose a primary care provider, or if you wish not to choose one or you don't have one in mind, you can select the Assign Provider button on the enrollment portal, and then Delta will assign a provider nearby your home. When you get your ID card, your primary care provider will be listed on your ID card, and this is who you need to see first for everything. Okay, so you can't just kind of go to any Delta Care USA provider. You must go to your primary care provider when you're using an HMO dental plan. If you do not like this provider, if you wish to change providers, you can call the member services number on your ID card, and they will help you find a new provider that's in the network. Also to note, orthodontia is available on just the HMO plans. So if you needed orthodontia, you'd be asked to pay a copay. And then the calendar year max, there is no calendar year max with HMO dental plans. PPO dental plans, you're going to see here in a second, do have maximum benefits on the year. So here's our PPO dental plans. We've got the gold and the platinum. We'll skip right to calendar year max because we just covered that. With the gold PPO plan, you have a $1,500 per year calendar max. Now this calendar max is per person enrolled, so each person enrolled in the plan. So if it's me, my wife, and 3 children, we would have 5 $1,500 maximums. Each one of us would have $1,500 to spend. And what calendar year max means really is once they have spent up to $1,500 in benefits on you, Delta Dental will no longer pay anymore, and you have to pay everything else. Notice that Platinum PPO plan is a $2,000 maximum, so it's a higher maximum benefit. Also, the Platinum PPO plan has the Premier network, so it's a bigger network than that Gold PPO plan. So one of the larger PPO networks you're going to find in the country is this Premier network from Delta Dental. So for those of you that crave choice, for those of you that have very specific providers you like to go see, the PPO dental plans are going to give you a lot more options in terms of providers. So that is going to be a good place for you to go. A good way to think about HMO versus PPO is HMO plans will cost you less, but you will have less choice. With PPO plans, you'll have more choice, but more costs. Okay, so that's our PPO dental plans coupled with our HMO. Those are our 5 dental plans we have available to you. We have our vision plans. There's 2 of them here, the gold and the platinum. Now, these 2 plans are identical in most every single way, except for one very important one. And I've circled it there towards the middle of the page. You'll notice on the gold plan, we have a 12-12-24 setup, and on the platinum, it's 12-12-12. What does that mean? The first 12 is the frequency in which you get your eye exam benefit. So with both of these plans, once every 12 months, you have a $10 copay for eye exams. The second number is how frequently you get your $25 lens copay. You'll see that that is every 12 months with both plans. The last number is how frequently you get your $180 allowance for frames, or not and, or the $150 allowance for contact lenses. With our gold plan, that's once every 2 years you get that benefit. With the platinum plan, it's once a year. Okay, so with the platinum plan, if you have this plan, you're going to get that $180 allowance once every 12 months. With the gold plan, it's once every 2 years or 24 months. So I love the platinum plan for this reason. There's nothing in the world wrong with the gold plan. Both the gold and the platinum plan have the same exact network of providers that you'll go see. The difference is for about $23 a year more for an individual employee, you will pay about $23 more in premium, and you'll get $180 of benefits available. So I love the platinum plan because it's just such a great value. A little bit more money, 23 more pre-tax dollars in exchange for $180 of benefits that are not taxable. So I love the platinum plan. My recommendation is definitely to choose that one if you need a vision plan. So here we're looking at all the different smartphone apps. I'm just kind of putting a plug in for this. If you are on any one of these plans, the number one thing you can do to improve your benefit experience is downloading the smartphone app on your phone. This is where you will always find your ID card. This is where you can communicate with your providers. This is where you can find doctors, understand your benefits, find the nearest urgent care location versus emergency room. In some cases, order prescription refills and see your most recent test results. So lots of really great information. And if you have not downloaded the smartphone app for the plan you are enrolled in, please do so as soon as you can. So let's talk about enrollment. I'm going to get out of the presentation here and get you into the actual enrollment portal. So what all of you are going to see is an email that's going to be coming to you that's saying, hey, welcome to EASE. You've been added to our EASE portal. Please log in. So you'll click this little login button right here, which I've already done. I'm on the login page. We'll get to our login, your username or password. For those of you that have enrolled through this system before, you are going to just log in with your previously selected username and password. For those of you that have not logged in before, you'll be choosing a password right here. So go ahead and do that and hit login. I enrolled last year, so you see I've got all my current elections here. I'm going to hit the start enrollment button to get started with everything. Hit start. This gives you an idea of what to expect. Get to this new page. Here's going to be the enrollment video that I'm recording right now, so you'll see this one embedded in here. It won't be the old one like what you see here. You'll hit continue, and you'll fill out all your information as you have it here. Continue. Add your dependents. So for any of you that have a spouse or have kids, please add them here. Adding them to this portion of the dependent section does not enroll them in anything. Rather, it just gives you the ability to see how much it would cost. I'll show you what that looks like here in a second. So if you have a spouse, if you have a child, if you have children, please add them here so that you can see how much it would be to enroll them. We continue. If you're on Medicare, go ahead and put that information here. If you're not, you'll continue right through it. And now you're getting into your benefit plan. So we have a benefit allowance. You'll see it here. You'll just hit continue. There's nothing really selected there. It'll be automatically selected for you. And you'll notice on the right here that my per pay period costs are totaling up. Watch what happens if I check my daughter's benefit, it changes instantly up here. My prices change right off the bat. So this is why I like asking you to put your children, your spouse in here, because you can very quickly see what it would cost to enroll them or not. Check mark means I would like to enroll. X means I'd like to waive. If you hit the X button, you'll be asked to tell us why. If you have the carrier name and the group number, please enter it. If you don't, just some random words and numbers would also work there. And here's where I get to see, I scroll in and I get to see the different plans. So in the gray, it's going to show you my current plan and what I'm paying per pay period. And as I scroll down, you see all the different plans and all the different prices. But then when I get to the plan that I'm enrolled in, it's pre-selected for me. All right. So here I see the California Choice United Healthcare Silver HMO E. I've got my all plans side-by-side comparison. So if I wanted to look at all these plans next to one another, I could do that right here. This shows me all the different plans and all the different benefits side by side. So for those of you that really want to get into the weeds and see how these plans compare to one another, go for it. You'll do so right there. You can download it, print it, whatever works for you. There's a benefit summary of just this plan. So you can see a little bit more details on just this plan if that's all you want to see. You can click here to find a medical provider. And so with the HMOE, this is part of the Alliance HMO network. So I wrote Search Alliance Network. All right, so this will take you straight to the MyUHC website. You'll find a provider right here. You can also find a pharmacy here if you needed to. Here's the mobile app flyer with United Healthcare. So that's a little bit of a plug for those of you on these plans. I tried to load those, when available, the mobile app flyers into there. Summary of benefits and coverages. This is a mandatory document that Obamacare says you must review. So you will be required to open this up. If you do not open this up for the plan you select at the very end of the process, you'll be kicked back and asked to do that. Here's a little United Healthcare value add compilation. So I put together a lot of the things that United Healthcare has at your disposal. So nurse line, virtual visits, Apple Fitness, membership, how the OnePass membership, Peloton app, Rally. This is the check-in, workout, get paid. So this gets you rewards for going to the gym on a regular basis. So good stuff there to review for United Healthcare people. And then here's a video tutorial, a YouTube video of me walking you through how to find a provider with United Healthcare. So I'm going to stay with that plan there. Of course, you can choose any one of them by hitting the select button here. Here at the bottom, I've notated that I wish to auto assign a provider. If I wanted to choose my own provider, I would click here, I would find a provider and I would write their PCP in their name here, or I'll just hit assign. And assign just means that you would like a provider assigned to you. Again, you can change this anytime you want. So we'll continue. Same thing with our dental and vision. I've enrolled myself, but not my daughter. There's my current price. There's the new price. It went down a few nickels. Primary care provider is here's who I want to choose. Okay, continue. Vision plan, same thing. Vision, prices stayed the same on vision. There's some extra links there for you to review. Chiropractic, I've waived chiropractic benefit. It's not very expensive, but it's not a knock your socks off type of chiro plan. So take it, leave it, whatever works for you, continue. You're going to see a summary here. You're able to print this summary if you wish. You can see how you enrolled everything. If I meant to enroll my daughter on medical, I could click this edit button and go back. Once I determine everything is how I want it, I'm going to hit the continue button. I'm going to sign forms. So for those of you who have used DocuSign in the past, this is going to feel very, very similar to that. You're going to wait for these forms to generate. And then you will type a signature just like that. You'll hit next, and then you'll use your mouse to do a signed signature. There you go, hit next. And then it's going to walk you through the whole app, and you're just going to click all the places where you need to insert your signature. And there you go. Now your document is all finished. Here's your actual application. You can scroll through it. You can review everything if you'd like. Otherwise, just hit the finish signing button here. Let us know how it was if you'd like. If not, don't worry about it at all, and click the finish button there. And once you do that, you're going to get an email that looks just like this, and it says, oops, that didn't mean to do that. It looks like this. It says, you have enrolled in your benefits. Your benefit elections have been submitted. Thank you so much. Blah, 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 all that stuff. So that is what you will do there. So just to current slide, we'll get back to our presentation. So that is our little tutorial and walking through. So what do you do now? You're going to be looking for that email that I showed you to start with. You're going to click on the login button. Please go through this and enroll or decline by June 21st. That's a Wednesday. Even if you do not wish to enroll, even if you got other benefits, even if every year you decline this coverage, you still need to log in and decline. Obamacare puts a lot of pressure on your employer to be compliant with offering health plans, and that requires that you decline your coverage every year if you wish to keep that same election. For those of you that are wanting to keep your same enrollment how it is now, this whole process should take you no more than 3 or 4 minutes, so it's not too difficult. So that's all for now. If you have any questions, if you need any answers, we are here to help. My contact information is on the screen there, and I would welcome hearing from any of you. Thank you so much for your time. It's an honor to be your broker, and let me know if I can help in any way. Thank you.